Did you know that while you're watching this video, about 20 seniors will be diagnosed with dementia? That's a shocking statistic. One new case every 66 seconds. But here's something even more concerning. The medications you keep in your medicine cabinet might not be as safe as you think. Many seniors are unaware that the very pills they rely on could be shrinking important areas of the brain that are crucial for memory by over 28% in just a year. That's a staggering figure. And unfortunately, the pharmaceutical industry has known about this for years while continuing to profit from these drugs. A more recent study from 2023 found that certain medications can increase the risk of developing dementia by 49% in seniors after just 2 years of use. In this video, we'll uncover 9 commonly prescribed medications that are linked to rapid memory loss and dementia. You'll want to stick around for our number 3 because it's often given for everyday issues, but could be quietly affecting your brain without you even realizing it. Before we dive in, I would love to hear from you. What medications are you currently taking? Have you noticed any sudden moments of forgetfulness or brain fog? We're here to listen and provide personalized insights, so don't hesitate to share. This conversation could have a significant impact on your cognitive health. Now, let's get started with number 9 on our list. Don't underestimate it. This is in virtually every senior's medicine cabinet. It could be affecting your memory before you even notice. First up is diphenhydramine, commonly known as Benadryl. This familiar pink pill is frequently taken for sleep, allergies, or cold symptoms, and it's very affordable, which is why many people keep it on hand. You might think you're just using it to help you sleep better, but diphenhydramine can disrupt the hippocampus, an area in your brain essential for forming new memories. As part of a class of drugs known as anticholinergics, it blocks acetylcholine, a neurotransmitter that helps with memory formation and alertness. As we age, every bit of acetylcholine counts, and taking this medication can have serious consequences. Recent findings in the Journal of Geriatric Cognitive Health indicate that seniors who regularly use anticholinergic drugs like diphenhydramine have a 54% increased risk of developing dementia compared to those who don't use these medications. So how can you stay sharp? First, try to avoid anything containing diphenhydramine, especially if it's labeled as PM, nighttime, or allergy relief, as these are often just variations of Benadryl. If you need allergy relief, consider safer alternatives like loratadine, sold as Claritin. These newer options don't cross the blood-brain barrier and are much better suited for long-term use in seniors. By taking these steps, you can safeguard your memory and enjoy better cognitive health. Remember, your health and longevity are worth the effort. When it comes to your health, understanding the medications you take is crucial, especially as we age. I want to share some important insights that could have a significant impact on your well-being and brain health. First, don't stop any medication suddenly. Always talk to your healthcare provider. But just because something is over the counter doesn't mean it's completely safe. Take proton pump inhibitors, PPIs, like Prilosec or Nexium, for example. They're often marketed as gentle and easy on the stomach, but they can actually interfere with vital nutrients your brain needs to function well. PPIs are commonly prescribed for conditions like heartburn and acid reflux, and many older adults find themselves taking them for years. However, what often flies under the radar is how these medications can block the absorption of vitamin B12, a key nutrient for your brain. Low B12 levels can affect your memory, focus, and even your mood. A significant study conducted in 2016 with over 73,000 individuals aged 75 and older revealed a startling fact. Those who regularly used PPIs had a 44% increased risk of developing dementia compared to those who did not use them. This is partly because PPIs lower stomach acid too much, making it tougher for your body to absorb essential nutrients like B12, magnesium, and calcium. When your brain doesn't get enough of these nutrients, it can lead to confusion and memory issues that mimic early signs of Alzheimer's disease. Moreover, there's even more concern. PPIs can lead to an accumulation of amyloid beta plaques in the brain, harmful proteins linked to Alzheimer's. The encouraging news is that there are safer alternatives. If you're currently taking a PPI every day, Talk to your doctor about the possibility of gradually reducing your dosage. Medications like H2 blockers, such as famotidine, commonly known as Pepcid, might be a better option. They're less likely to impact your cognitive function. Plus, you might also consider a natural remedy like deglycyrrhizated licorice, which can soothe your stomach without negatively affecting your brain. Another medication to be aware of is oxybutynin, often prescribed for bladder control. Although it might seem like a sensible solution to avoid frequent bathroom trips, this medication can also harm your memory and emotional well-being. Oxybutynin works by blocking a brain chemical called acetylcholine, similar to what happens with some antihistamines, like Benadryl. Unfortunately, this medication can cross into the brain more easily and directly affect areas involved in memory. A 2019 study revealed that seniors over 65 who used strong bladder medications like oxybutynin for more than a year had a 49% higher risk of developing dementia, a staggering statistic. What's troubling is that many older adults aren't warned about these potential cognitive side effects. They're often told only that it will help control their bladder issues, not that it may contribute to memory decline. This can sometimes be mistaken for normal aging. If you've noticed feelings of fogginess, forgetfulness, or difficulty following conversations, it could be an issue worth discussing with your doctor. Your health is a priority. By staying informed and involved in your treatment options, you can make choices that support not just your physical health, but also your cognitive well-being as you age. Make sure to have these conversations with your healthcare provider. They can be life-changing. Understanding the impact of medications on your health, especially as we age, can be truly transformative for your well-being and longevity. If you're taking certain medications, it's crucial to be aware of their potential effects on your brain. For instance, if you're on oxybutynin and have noticed changes in your thinking or memory, know that you're not alone. These effects are real, and you don't have to resign yourself to them. Thankfully, there are newer options available, like mirabegron, marketed as Myrbetriq, that are gentler on the mind and still help manage your symptoms without blocking an important brain chemical called acetylcholine. Another common category of medications to consider are statins, which are often prescribed to help lower cholesterol and reduce the risk of heart disease and strokes. While they are widely used, especially for those over 60, it's important to remember that cholesterol is also vital for brain health. In fact, the brain consists of about 60% fat, and cholesterol is essential for maintaining the protective sheath around our nerves. A recent study published in 2023 highlighted that seniors over 70 who had been on statins for more than 3 years had a 26% increased risk of mild cognitive impairment. Those on higher doses faced even greater challenges, with reports of sudden memory loss. Fortunately, not all statins affect the brain in the same way. Some, like pravastatin and rosuvastatin, have a lower risk for cognitive side effects. If you've been on a statin for a while and are experiencing memory issues, it might be worth discussing with your doctor about adjusting your dosage or exploring alternative treatments. Also, think about benzodiazepines, which include medications like lorazepam, Ativan, and alprazolam, Xanax. These are often prescribed for anxiety and sleep difficulties. While they can provide relief by calming the brain, prolonged use can become problematic. A study from 2022 showed that seniors using these medications for more than 3 months had a 51% increased risk of developing Alzheimer's disease. Long-acting benzodiazepines, in particular, can accumulate in your body and lead to decreased brain function and increased confusion. If you've been using these medications for a long time, don't hesitate to reach out to your healthcare provider. They can help you explore safer alternatives or adjust your treatment to protect your brain health as you continue on your journey. Remember, taking proactive steps today can make a significant difference in preserving your mental clarity and overall health in the years to come. Your well-being is worth it. If you're in your 40s to 70s and finding that daily life feels more challenging, especially if you're on certain medications, you're not alone. Many people taking benzodiazepines, often known as benzos, report feeling foggy or not quite themselves. The truth is, when you try to stop these medications, it can lead to tough withdrawal symptoms like anxiety, restlessness, and trouble sleeping. These symptoms can make it feel like the medication is necessary for your well-being, when in fact, it may be contributing to the very problems you're facing. Here's an important takeaway. If you've been using a benzo for more than a few weeks, don't just stop suddenly. Doing this can be risky. Instead, it's crucial to partner with your doctor to gradually reduce your dose. There are gentler options available, like buspirone for anxiety or cognitive behavioral therapy, CBT, for managing insomnia and anxiety without the mental fog. Let's talk about another medication you might be prescribed, amitriptyline, also known by its brand name, Elavil. This older antidepressant is often prescribed for pain, insomnia, and even migraines. While it might seem like a miracle pill, there's a downside. It can have a strong effect on your memory because it interferes with your brain's ability to communicate effectively. In a significant study involving over 3,400 older adults, those taking higher doses of anticholinergic medications like amitriptyline had a dramatically increased risk, 54% higher, of developing dementia over 10 years. That's more than a small bump. It's a serious concern. What's alarming is that many patients are unaware of this risk when they start taking it. They might first notice memory loss or difficulty focusing, which can easily be mistaken for normal aging rather than a result of the medication. Even at lower doses, long-term use can cause slow cognitive decline without obvious warnings. So, if you or someone you care about is on amitriptyline, it's time to have a chat with a doctor about alternatives. For nerve pain, medications like duloxetine or gabapentin might provide relief without as much risk to your memory. For sleep, melatonin or low-dose doscapin could be effective options to consider. And for mood support, newer antidepressants like sertraline or escitalopram are usually gentler on the brain. Lastly, let's touch on paroxetine, known as Paxil. This is a widely used antidepressant that belongs to a group called selective serotonin reuptake inhibitors, SSRIs. While it seems modern and a bit kinder than older antidepressants, it's still important to be vigilant about how it affects your overall health, especially your cognitive function. Remember, prioritizing your brain health is vital for your quality of life. Taking these proactive steps can truly be life-changing, helping you feel sharper, more connected, and ultimately more like yourself. Your mind matters, so let's treat it right. It's crucial to be informed about the medications commonly prescribed to older adults because some, like paroxetine, can significantly impact both mood and mental clarity. Here's what you need to know. Paroxetine is a type of antidepressant known as an SSRI, but it has unique properties that can interfere with important brain chemicals. Unlike other SSRIs such as sertraline or escitalopram, paroxetine has been linked to declines in memory, attention, and focus within just a year of use. A large study found that seniors taking paroxetine were 30% more likely to experience early signs of cognitive impairment than those on other, safer antidepressants. Ironically, while it's intended to improve mood, it may actually harm mental clarity over time. If you or someone you care for is on paroxetine, it's a good idea to talk with your healthcare provider about switching to alternative options that are more suited for seniors, such as sertraline or escitalopram, which tend to be better tolerated and carry fewer risks to cognitive health. Additionally, supplementing with B vitamins like B12 and B6 can offer natural support for mood and brain health. Now let's talk about another group of medications, antipsychotics. Many older adults might be unaware that they are prescribed drugs like quetiapine or risperidone, originally developed to treat more severe mental health issues, but now often used for less serious conditions like sleep problems or restlessness associated with dementia. Unfortunately, these medications can have devastating consequences. Recent studies have shown that seniors taking antipsychotics for behavioral symptoms are much more likely, 71% more likely, in fact, to experience worsening cognitive decline within a year, even if they had no previous dementia diagnosis. These drugs can also increase the risk of serious health issues like stroke and severe sedation, which can lead to falls. This slowdown happens because antipsychotics suppress dopamine, a vital brain chemical linked to mood, motivation, and memory. When dopamine levels drop, older adults may seem emotionally flat, and family members can feel like they're losing the essence of their loved one, even when they are still physically there. If you or a loved one finds themselves on such medications, it's important to ask your doctor some challenging questions about their necessity. In many instances, behavioral problems can be tackled through non-medication approaches, like creating structured routines, minimizing noise, managing pain, and improving sleep quality. Remember, being proactive about your health and the medications you take is key to maintaining quality of life as you age. Don't hesitate to have these conversations. They could be life-changing for you or your loved ones. Take control of your health, the hidden risks of multiple medications in seniors. When it comes to medications, it's crucial to remember that sometimes less is more. While there are moments when a medication is essential, opting for lower doses and shorter treatment periods can help reduce risks. Unfortunately, many people use medications out of convenience without fully understanding their effects, leading to troubling changes in their loved one's health that may be caused by these medications, rather than aging itself. One of the sneakiest dangers in this realm is something called anticholinergic polypharmacy. This term might sound complex, but it essentially refers to the risk involved when someone takes multiple medications that block a brain chemical called acetylcholine. What's concerning is that this combination can significantly increase the risk of drug-induced dementia among older adults, a fact that is often overlooked in discussions about medication. Let's break it down with an example. Picture a senior who takes diphenhydramine to help with sleep, oxybutynin for bladder control, and amitriptyline for pain relief. While each of these medications may not cause major memory issues on their own, together they create a much larger problem. This accumulation of anticholinergic effects can lead to major cognitive decline. A recent study published in Age and Aging tracked over 280,000 seniors and found that those with the highest exposure to anticholinergic medications had a staggering 120% increased chance of developing dementia over the next decade. That's more than double the risk. The concerning part is that many older adults don't even realize they're taking these kinds of medications. When multiple drugs inhibit the action of acetylcholine, it can slow down the brain's activity and, over time, lead to a decline that mimics serious conditions like Alzheimer's disease. The good news is that you don't need a miracle to change this scenario. It simply involves a thorough review of your medications. I encourage you to take a proactive step. Talk to your doctor or pharmacist and ask them to evaluate your full list of prescriptions, any over-the-counter medications, and even supplements for their anticholinergic effects. There are tools available that can help assess the total impact of these medications on your brain health. From there, you can work together to reduce or safely switch out any unnecessary medications, helping to restore balance to your brain. Here's the biggest takeaway. Drug-induced dementia can often be reversible. Many seniors notice significant improvements, like enhanced clarity, energy, and memory, once they reduce their medication burden, often within just a few weeks or months. Our brains are remarkably resilient. They simply need the opportunity to heal. Understanding and addressing polypharmacy is not just about avoiding risks. It's about empowering yourself or your loved ones to maintain and enhance cognitive health. Now, we'd love to hear from you. Are you currently taking any of these medications? Have you experienced any memory lapses or mood changes since starting a new prescription? Are you ready to discuss a medication review with your doctor this week? Share your thoughts and experiences in the comments below. We're here to support each other on this journey to better health. Thank you for watching.